Welcome to the Physionic Podcast. This is going to be a special episode. Today, I have a special guest. Alyssa, do you want to introduce yourself?
Hi, I'm Alyssa. I met Nick in college at ECU in a nutrition class, and I also have endometriosis, so that's what I'm here to talk about today.
Yeah, right. So we're going to be talking about the topic of endometriosis. If I'm completely honest, though, I didn't know anything about the condition beforehand, and then Alyssa contacted me, like 2 weeks ago, something like that. And I was in town, so thought, why not cover this? This is kind of a fascinating condition because it's something that it's slowly starting to snowball in terms of the amount of people that are kind of coming out being diagnosed with it, and it doesn't seem like physicians know a whole lot about it. So, and Alyssa actually sent me a paper, or turned me on to a particular paper that we're going to be discussing at the end, that's going to kind of give an explanation to a question that's kind of at the heart of endometriosis, which is what causes the pain associated with endometriosis. So we're going to cover that at the end, but for now, we're going to cover what is endometriosis. So I'm going to let Alyssa go off on that, and then we're going to be covering things like what you should look for, like symptoms, kind of your experience, things of that nature. So hopefully it'll be helpful and informative to anyone who suffers from it or has a family member or friend that has endometriosis. If you're watching this after the fact, I apologize. The lighting isn't perfect, but that's the audio quality should be great quality as we go throughout. So let's jump into it. Let's jump into kind of the basics. What is endometriosis from your experience and what you've looked up?
So what is endometriosis? Endometriosis is a condition in which tissue that is similar to, not exactly, we don't think, but tissue that is similar to the lining of the uterus is in places it should not be. So it's not in the uterus. It's in places like your ureters, pelvic sidewalls, intestines. They found endometriosis on every structure in the body. We don't know why that happens. That's a big question. But it's a condition where that tissue is growing outside of the uterus, and it is extremely painful. The main symptom would be pain, if you ask anyone.
Okay. So it's essentially, so endometrial lining of the uterus is supposed to be there when it's in the uterus, but if it somehow, and I guess my next question is, like, we don't know why it goes other places, it ends up in other places, so that's kind of one of the big mysteries, right?
Right, and there are lots of theories. A lot of them have been disproven. We have not proven a theory yet as to why that happens, and unfortunately a lot of doctors still practice based on these theories that have been disproven.
So can you talk a little bit about a few of those?
Yes, so one of the main ones about why this tissue ends up in places it should not be is that this theory called retrograde menstruation. And that is where people believe when a woman menstruates and the blood is supposed to leave the vagina, it is coming up through the tubes and somehow leaving the ovarian tubes and migrating elsewhere in the pelvic cavity. That never really made sense to me, but that is the theory that a lot of doctors practice based on.
Do you know by any chance where that came from, or like why they would think something along those lines? Like, because you even mentioned that endometriosis can be other places that you would definitely not think would come from, like something as simple as that, just like the retrograde movement,
they found
just moving
it
through the fallopian
in
tube.
Cardiac tissue. I've had a doctor say she found it in a woman's wrist before,
Yeah,
in
that's
a
crazy.
cyst. I imagine that means it's also been found in the brain, anywhere. To me, if retrograde menstruation was how this was happening, it would all be concentrated on the pelvic sidewalls, around the ovaries, and that's definitely not the case.
Right.
There is a specific doctor, and the theory is named after the doctor. I cannot remember who it is.
It's fine.
But there is a lot of research behind that not being true, even though it's been kind of the standard of how it's treated.
Okay, so that's one of the theories. Do you know of any others that have been really prevalent? I didn't look into it too much, but I know there was like a kind of a hormonal component at one point, wasn't there?
Right. So this is a very broad, and it could have a factor in endometriosis, but another, if you're looking at it from a hormone perspective, a lot of people like to just throw around the phrase estrogen dominance.
Okay. And what would that mean?
I guess just meaning that for any particular reason, I or any other woman with endometriosis produces an excess of estrogen, or her other hormones are depleted to where estrogen is dominant, and that would somehow trigger the growth of this tissue.
Okay. Yeah, so there are a number of different theories or hypotheses as to why this is happening. And some of them have been disproven, like you mentioned, and some of them have yet to be disproven or proven correct. Or, in science, you can't really prove something, but you can eliminate so much doubt that it ends up being that's the predominant theory. So that's a decent explanation of what endometriosis is. It's the endometrial lining that should be in one place and it ends up being in a number of other places. And I didn't even know it could happen on the wrist or around the heart. That throws a whole nother component to it that really adds a ton of mystery to what the condition really is. So let's jump into the next question. So what are some of the signs and symptoms that you've experienced and that you know that other people have experienced?
Okay. I'll start with the basic signs and symptoms if you were to do a Google search of endometriosis.
Okay.
It's classified as extremely painful periods, heavy periods, and pain when you're not on your periods. Basically pain, and heavy bleeding. That's what you're going to find if you look it up. That is definitely what a lot of women experience. For me, personally, I never had a bad period in my life. I never had an abnormally heavy period from what I was used to. And I woke up one day with just stabbing pain in my abdomen. And it took me a long time to figure out what that was. It took me about 2 years to get diagnosed. But for me, after tracking my symptoms for months and months and months, I found out that my pain was always happening about 3 days after my period would end, so it was not associated with bleeding for me, and it would trigger something, period, fine, normal, 3 days later, extreme pain, could not get out of bed. The only thing I can describe it as is just being stabbed over and over again in your belly, hips. For me, I would get shooting pain down my hips, nerve pain into my feet. I had peripheral neuropathy. I had extreme back pain. I couldn't get out of bed for 5 days at a time. That would happen for me the first 3 months of experiencing flare-ups like that is what I call them. They would last for about 5 days and then go away, and then it's nothing happened. As this went on, I started having an all the time overall kind of burning sensation in my abdomen, along with a lot of extra bloating. And on top of that, at that same time every month, the extreme pain.
Okay. So it lasted for a number of days then. And when it first came up, the first time it ever happened, it was rapid onset or?
Rapid onset. And looking back, so I guess I take that back. It was not rapid onset. I had some discomfort that I remember now looking back on the situation that was not normal for a few days leading up to me ending up in the emergency room for pain.
Yeah.
And by that, I mean just kind of light cramping, I would describe it. And my hips were achy and just it didn't feel right. It was almost like I was getting my period, but I had just stopped my period. And I remember that later. And then I obviously didn't think much of it then. But yeah, the extreme pain came on overnight. I had been fine throughout the day. I had been working as a personal trainer and going to class, and I woke up in the middle of the night with just extreme pain. It's the only way I can describe it. Like, I felt like I had a knife sticking in my like pelvic area, and it just did not feel right. And I debated for a long time, do I need to go to the emergency room and all this stuff, and I ultimately did.
And when you went to the emergency room, do you remember what the doctors initially thought it was? Like some of the misdiagnosis that may have occurred?
Unfortunately, not much was really done. They did a pelvic exam, and they said that it was normal. And then, even though they said the pelvic exam was normal, they still decided to put me on an antibiotic because they said that I had, I can't remember, the antibiotic ended up being for nothing because they said that the exam was normal, and all that they did, they took a urine sample, and I think that's it. They just did a urine sample and the pelvic exam.
So they were testing for UTI essentially, or some sort of infection. Yeah,
and it all came back normal, and they were like, well, we'll just put you on antibiotics anyway. I believe they did do an STD test, and that all came back fine. And they were just like, yeah, just take this antibiotic even though everything was normal. And then I went to go see an OBGYN after that about a week later.
And what did they say?
He just basically, he put me on birth control, which is a whole other conversation. And I actually didn't start taking it right away because I had gotten off recently because I just other side effects I didn't want to have.
Right.
Yeah, his solution was birth control, and I unfortunately kept going back to that same doctor until we finally did an ultrasound and saw that I had some kind of cyst, which his solution was birth control as well. So
okay.
Not to get into too much.
Interesting diagnosis.
Really, they don't really, unfortunately, I don't think a lot of doctors know what to do when you come in with pelvic pain.
Right.
Their solution is birth control. Just shut it down. Which does not work for endometriosis.
Yeah, that's pretty crude. Unfortunately, in science, I think women's health is lagging behind men's health in that regard, because a lot of the science in the past, really dating back for a long time, was only based on males because they were easier, because you didn't have to account for estrogen and progesterone and, FSH and luteinizing hormones. Certainly all of them are involved for men, but it certainly doesn't cycle quite as much. So that's an unfortunate reality when it comes to research, and it sucks to see that kind of permeate into the clinical world. So this doctor kept prescribing different birth control. So what ended up leading you to, did you push for this ultrasound, or
I did.
Like, what happened?
This was my third appointment in about a month and a half. And I just kept going with the same pain. It had been getting worse and worse. And when I called to make this last appointment with him, I had called to make the appointment for the ultrasound because I'd been doing some research at this point, and I was like, well, I think that'll be the easiest thing, is just get a picture of what's going on in there. And he didn't want to do it, and he was speaking with his nurse, so he wasn't even addressing me while I was sitting in the room. He was addressing his nurse, and he said, well, we're just going to put her on some more antibiotics, and was going to leave it at that. And that's when I really had to stick up for myself. And I cry when I get mad, so I started crying, and I was like, no, I'm not taking any more antibiotics. That's obviously not working, and I've been on them for about 2 months at this point, from my first ER visit. And when nothing's wrong, like, he just got done telling the nurse that everything came back normal, my blood is normal, urine's normal, all of that. I just refused. I was like, I'm not doing that, and you're going to take an ultrasound. And he was just like, well, you can go wait in the waiting room. It'll probably be a few hours. And he was just very nonchalant about it. So I waited there that day. I got the ultrasound done, and I had a cyst on what we thought it was on my ovary. So he's now thinking, okay, well, you have an ovarian cyst, and it looked kind of funny. So he was like, well, the treatment is still birth control. It'll probably go away on its own. And that's where we kind of left things.
Okay, so then what happened after that? Did you go to a different doctor, or did you try the birth control, or did they do follow-ups for that cyst, or how did you end up actually diagnosing the endometriosis?
So I went to a different doctor eventually. I don't remember how many months later. And she actually was the first person. Okay. I think I went to the health center at ECU actually after this.
That's the school that we went to, East Carolina University.
I remember parking my car like across the street from campus and literally like hobbling, like bent
Right.
over into the clinic, like could barely walk. I don't know how I made it to this appointment. And they actually had a brochure about endometriosis in there.
Wow.
And I picked it up, and I'd seen it a few times online at this point with my searches.
Yeah.
And was like I didn't think I had it then, because all of the symptoms were like, oh, well, you probably have terrible periods and like extreme bleeding and all of this stuff. And my symptoms didn't line up with that exactly, but the pain aspect was there. So I asked her, I was like, do you think I could have this? Like, what's the deal with getting diagnosed with it? And she was just like, oh, you definitely, like, she for sure was like, I don't think you have that at all. It would present differently. Like, didn't give it a second thought. So that made me feel better in the moment, because I'm like, okay, well, at least I don't have this. Like, it's got to be something else easier. Right. I don't remember really what else came out of that appointment, but I that was kind of a, looking back, kind of a big deal. And then I went to a different OBGYN, and she was the first one that said, I think you have endometriosis because of this type of cyst. She had gotten my records from the old doctor, and was like, well, yeah, I mean, they basically ruled it out. It's not this kind of cyst. It's not like a simple cyst that's going to go away. It has this weird calcification in it. We think it could be an endometrioma, which is the cyst aspect of endometriosis. And so she was like, yeah, I mean, I think you have it. You have this kind of cyst, so I don't have any reason to say you don't. Her solution was birth control. I was getting very frustrated at this point. That's kind of when I stopped going to the doctor for it, because I just knew birth control isn't the answer.
Right.
I ended up, at this point, like, I almost had to drop out of school because I was in so much pain all the time. I had to quit my job, was not making it to class because I was just in bed.
Yeah.
I did eventually start taking birth control because I figured if this gets rid of the pain, I can at least finish school, and it worked, and it did serve me very well in that aspect. All the while knowing, just because I'm taking this and I'm not feeling the symptoms, it is not taking care of the disease. That cyst isn't going to go away just because I'm taking birth control. And this is all because I was reading my own research. And I guess I should go ahead and talk about Nancy's Nook at this point. It's a group on Facebook of 50,000, maybe even 100,000 women with endometriosis, and they provide a list of doctors who are appropriate for treating the disease, and it's a learning-based group. It's not an advice group. You go on there and you read all of the resources they provide. They have surgeons and other doctors and nurses who work very closely with these patients or have firsthand experience with the disease, moderating all of the discussions that go on the group. And so I kind of dove into that, and that was my resource, and that was really empowering because I finally had understanding and other people going through the same thing, and I was able to find out for myself treatments that were worthwhile and what to stay away from when doctors that were pretty uneducated were throwing different hormonal solutions at me.
Okay.
That was a lot.
No, that was great. What's the name of the group again?
Nancy's Nook.
Nancy's Nook. Okay. Just want to make sure I get that on recording. Okay, so do you know by any chance how long we've known about endometriosis just kind of existing just in the clinical world?
Clinical world? So the moderator of the group was diagnosed, I'd say 50 years ago, and she's one of the pioneers in endometriosis, I think, and that was about 50 years ago. I think women have had it forever, and I think there's a lot of research and history that shows that women have suffered with this for a very long time, and we're
Right.
kind of just taking it seriously.
Mhm.
I'd say probably about 50 years, though. That's a very rough estimate
Right. So,
of having a word for endometriosis.
but it's certainly been around for much longer than that. I mean, our human physiology didn't start 50 years ago, so I understand that. But even the clinical aspect has been around for a while. I mean, 50 years is quite a while. Okay, so with that said, are there like particular doctors or particular things that you do that you feel help with the condition, or that you've kind of discovered over time that have helped with the condition as you've been dealing with it?
So other than birth control, which pretty much completely got rid of my symptoms, I made the decision to get off of it because it wasn't doing great things for the rest of my body, and just knowing I still had the condition, for some reason, I was like, I'd rather just be in pain than deal with all these other side effects, which is really hard because it really is painful. But I changed my diet a lot. There's a lot of people that talk about diet and lifestyle with endometriosis, and while I don't believe it is a lifestyle disease, I don't think you eat poorly and don't work out and get endometriosis.
Because you've been fit, for a long time.
I mean, going into like having this disease, like I worked out every day. I was a personal trainer. I ate in what I thought was a healthy way, and that kind of turned my world around because I went from like working out all the time, and it's like, well, gosh, like I thought I was super healthy and now I have this disease. So I don't like the idea that endometriosis is a lifestyle disease, and there's a lot of people kind of spreading that around. But I did change my diet a lot, and this could be a little bit of placebo, it could be some truth, but they say like the anti-inflammatory diet, so cutting out like gluten and dairy, is supposed to help. So I already didn't eat a lot of dairy, but I cut out gluten, and it did help because like I mentioned before, I was extremely bloated.
Right.
And so it kind of took that aspect away. And when you think about having like all that pressure in there from what I now know was a giant cyst on my uterus,
Right.
I mean, decreasing any bloat from eating a lot of grains and carbohydrates is obviously gonna maybe help just the physical sensation of your belly not being big. So I think that's more what was happening for me, at least, but it did help, and I stayed on that diet for about 2 years until I just had surgery. Other than that, I mean, there's really, unfortunately, nothing I could do. I was taking 12 ibuprofen a day on top of Percocet, on top of laying on a heating pad, just laying in bed.
Yeah.
So, I mean, unfortunately, there wasn't anything I could do to really alleviate it other than wait.
Wait for the pain to just dissipate over time at some point.
Wait for like the 4 days to be up for that flare up.
Yeah, that's interesting. Do they have any idea why there are specific flare-ups, like why it's only a particular number of days?
I have no idea, and for me it's so much different. I haven't found anyone else that said that they had flare-ups like me, like after their period. For most people, like they would have like a terrible period and then either have like some kind of low-key form of pain the rest of the month, but that's not extreme, or they're fine. For me, it started out having extreme flare-ups every month to still having extreme flare-ups every month, but also always having some form of pain regardless.
Okay. So how did you end up ultimately having to deal with it? Like you had lifestyle changes, birth control, lessen the pain, things of that nature, but how did you end up actually treating it?
Well, so I'd been a part of this Nancy's Nook Facebook group for about 2 years at this point.
Right.
The great thing about that is you get a lot of firsthand stories of people after surgery, and surgery is the gold standard of treatment for the disease, even though it's not a doctor's really first choice, especially just a regular OBGYN.
Right.
That first doctor I went to said there's no way I'm going to cut into you. You're 20 years old, and then offered me the solution of
Birth
getting
control?
well, this is the other thing. He said you can either go on birth control or you can get pregnant. And he's like, usually these things, like once you have a baby, they just kind of clear up, like no big deal. So then for me, and I'll get back to the next point later, but for me, I was like, okay, like I was like, that's unacceptable for you to say to me.
Right.
But I was like, let's just go with it. So I said, okay, so what are my chances of getting pregnant with what we just found, this cyst, and with what you think might be going on with me? He's like, oh, well, you're not married, so we can talk about it when you get married. So I'm like, so you just told me that getting pregnant could be a solution to this disease, and you won't even discuss it with me because of whatever your views are with
Right.
me having to be married
Right.
to get pregnant. So then I kind of just walked away from that situation. But anyway, so yeah, I was reading a lot of these stories of women who did have surgery for it. And while I knew surgery or some kind of operation was needed to diagnose the disease officially, I was kind of at the point where I was like, well, I'll just wait until right before I want to have kids, just to give myself the best chance of getting pregnant if that's what I want to do. And I was kind of on the road of wanting to put it off as long as possible, knowing
Right.
that it was probably in the future. But I was sitting in my room one day having a terrible flare-up, like I felt like I was going to explode. And I was just like, I can't live like this any longer. And the other thing that prevented me from seeking out surgery sooner was that there was no doctors in North Carolina that were qualified. And Nancy's Nook takes you through a whole thing of what makes you qualified to treat endometriosis. That
Okay.
means,
Yeah.
one, being an OBGYN surgeon,
Right.
but two, having gone through a MIGS fellowship, and that stands for minimally invasive gynecological surgery.
Okay.
So that's extra training on surgery that's usually specific for this disease. There's not a whole lot of gynecological diseases that require that. So Nancy's Nook has a list. You'll hear them referred to as Nook doctors who are approved, that have gone through this fellowship. They only do endometriosis surgery for the most part, and they have good outcomes. Those are the 3 criteria for getting on Nancy's Nook
Right.
list for doctors, and there were none in my area. The closest was the Center for Endometriosis Care in Atlanta, which is all out-of-network provider, and there's a doctor in Virginia and a doctor in the western part of Tennessee. So I knew it was going to be a lot of travel if I
Right.
were to do it, and I just wasn't ready for that. But I had a flare-up that was unlike any other, and was just sitting in the room crying, and I was like, I have to start this process because I was like, I'm going to lose my job. 2 jobs had already been affected by endometriosis. I ultimately had to leave them because of it, because they were personal training
Right.
positions, and I just couldn't get out of bed every day and do that.
So,
So
the-
quality of life was going
Quality of
down
life,
a
yeah.
lot.
So you said that last flare-up really kind of set things in stone, like you had to deal with it. Does that mean that each flare-up was progressively getting worse?
Yes.
Okay. And you think that's because the cyst was growing or because it was going in other areas? What?
Probably a combination of both, but the cyst that we found at my very first appointment was 2 centimeters, and then when it was removed, it was about 8 centimeters. So I'm sure it had to do with how large it was and it growing each time.
To give a reference, when did they find the 2 centimeter cyst, and when did you, like how much time persisted between the 2 times when you had it removed?
So it was my 21st birthday when I first started having symptoms. That would have been, it's 2019, so 2017. So it was like May of 2017, May, June, and I just had surgery in August of 2019.
Okay.
So pretty much exactly 2 years from finding it, which it had probably been growing for a while,
Right.
and it being removed.
Okay. So it grew 6, you said 6 centimeters or
Mhm.
millimeters?
Centimeters.
6 centimeters over a 2-year period then. And obviously we don't know exactly when it started from the beginning. Okay. So you've mentioned just how to find doctors and things of that nature. Do you have any advice for when you should actually see your doctor? Is it initial signs? Because you mentioned you felt a little achiness for a few days and then it like hit full force. Do you have any recommendations when it comes to that?
I'd say if you're ever considering or have gone to the emergency room for pelvic pain, you definitely need to get an opinion from one of these doctors.
Okay. And
I mean, your period should never be bad enough that you're considering going to the emergency room. That's not how it was meant to be. And unfortunately, I think a lot of women are told that that's normal from a young age, from the onset of their period. For me, I never had a bad period, so I think I had a little more leverage in saying I've never experienced anything like this before, and all of a sudden I am. But I think there's definitely women who have endometriosis that have always had bad periods, that were always just told this is how it is and that's how it's supposed to be. But I think if you've ever considered going to the emergency room, if you vomit regularly when you're on your period, or if you faint from pain.
yeah, so pretty extreme. I mean, extreme, like really extreme.
Yeah.
Okay, so if, let's say, a woman were to be in your shoes and end up with a doctor who just says, take birth control, it's just a bad period or whatever, would you say that to discover the problem, do you think that they should push specifically for something like some sort of imaging like you did?
So it's kind of bittersweet. I got kind of lucky that anything even showed up on my images.
Okay.
Endometriosis is not visible on an ultrasound or an MRI. It does not diagnose. You can't usually see it. The only reason you could see mine is because there is a cyst in the perfect place that was visible, and you can have endometriosis without having any kind of cyst or endometrioma. So it's not necessary to get diagnosed. I'd say if you want to rule something out and you're trying to take that little step to maybe prove something, you can do it. But ultimately, if you suspect endometriosis, you might as well not waste your money and just go straight to one of these NUC doctors.
Okay. Yeah, so I think that's an incredibly important point because, I mean, me knowing very little about it, I would think that based off your previous story that you could just do some sort of imaging and find it. But I mean, as you just said, that might not work. So you may still have endometriosis even though you don't find it.
And then that just gives a doctor another reason to write you off, which is unfortunate. That should never be the case. But I mean, it's from my experience.
Okay. You mentioned kind of off air that they did blood tests for C-reactive protein, so an inflammatory marker. And for you, it was elevated. So we're going to touch on this in a little bit, how inflammation plays a factor and whatnot. So did they look at any other inflammatory markers when they looked at yours? Because if that were the case, and if you can't get any sort of imaging, then maybe you could at least get some blood work done. And if you have some of these inflammatory markers that are elevated, maybe you can't necessarily say that's because of endometriosis, but at least it gives you a little bit more of a clue.
And I actually just remembered they did come out with a blood test that can diagnose endometriosis, and I imagine that would mean testing a lot of different inflammatory factors. That's not what I had. I think I had like a bunch of blood work done, like all the basic stuff, and then obviously whatever goes along with the CRP, and I think I specially requested that because I knew that that was an inflammatory marker, and my doctor was just like, whatever, we'll do it. But I mean, ultimately, you're not going to get a diagnosis, and you're kind of just beating around the bush if you start with all these other tests.
Right.
I mean, you could, but it's ultimately not going to help anything, and it's just an extra test that the doctor has to justify. But Yeah, and there is a blood test that came out specifically for endometriosis. I don't know too much about it, but I imagine it is looking at those inflammatory markers. It's been deemed pretty unreliable, though, so I wouldn't completely recommend that.
Yeah, I imagine that treatments or really diagnosis is relatively early in the stages. I know the research is pretty new when it comes to just looking at endometriosis and even just trying to figure out why it occurs. That's one of the great mysteries based off of my little reading that I did. How many people roughly suffer from endometriosis?
It's about 1 in 10 when you look at the statistics. I'd say probably 3 in 10. And that's just based on how many women, like I just talked about, are just told that their pain is normal and never think to get it checked out and just suffer in silence. I think just in my work, I work in an orthopedic physical therapy clinic, and pretty much any female patient I've mentioned it to knows someone that has endometriosis or had endometriosis themselves and were treated with birth control and a hysterectomy and all these other things. I mean, I'm working with 60 and 70-year-old women every day, so obviously they're not treated in the same way I am now with where research has come, but every woman I talk to has some kind of story about endometriosis, so I'd imagine it's a lot higher.
Can it hit at any age, or is it roughly when you're younger?
I'd say any age. I wouldn't say it comes on at any age. I don't know for sure that, but I know you can continue to have endometriosis and suffer from it well into menopause. I've also read stories from parents who have posted on Nancy's Nook about their young daughters as young as 8 years old, sometimes suffering with pelvic pain, and they haven't even started menstruating yet.
Right. Okay. Yeah, I think that's really important information as well. Just making sure that people understand that it's not just once you hit puberty. You know, it can happen certainly far before then as well. Okay, yeah, great. So actually, to lead into that, how did you end up running across this article?
Instagram. Social media was a huge factor in me getting a diagnosis. If it wasn't for Facebook and social media, if it wasn't for Instagram is where I found out about Nancy's Nook. I never would have known to look for the doctors I did. And I'd still probably be suffering with the disease. So social media has been huge for me. I found out about Nancy's Nook through a random comment that wasn't even directed at me. I was just reading through comments on another post that was about endometriosis, saw Nancy's Nook, joined the group, educated myself. I mean, one of the things you agree to when you join Nancy's Nook is that you're going to sit there and read the research. You're not just going to start posting things. You have to read about a dozen articles and papers before you're allowed to post, and just so everyone's on the same page. I forgot what the question was.
No, that's fine. Just how you found this particular study that you ended up sending.
So yeah, Instagram, I ended up following a lot of other women that have endometriosis, and one of my friends I follow posted a screenshot of this article that said possible cure or treatment that targets the root cause of the disease or one of the causes and not just a hormonal treatment for the disease. So I went and looked it up, and then I just started thinking like, wow, I wish there was someone that one could actually understand this and two had a platform to talk about it, because there's not a lot of people discussing the actual science behind the disease. There's a lot of like lifestyle and stuff discussion about it, and then I texted you. Yeah. And here we are.
Right. So let's jump into a little bit of the paper. I'm not going to be going through everything. I talked to you about that off air, but for anybody listening to this, I will have the paper linked. I'm actually going to have, don't worry about that. I'm actually going to have more content specifically on this paper to discuss kind of the figures, like how to read some of this research that of how they went about the study. So they had a series of different experiments, and really the question that they were trying to answer, again, we talked about this off air, that they're trying to figure out what causes the pain that's associated, the doubling over of pain that essentially ruins a person's life. Like they can't even, you mentioned like you had to drop out of particular work and you doubled over going to the student health center just trying to get some sort of help. Well, this paper, which was pretty well done, try to figure that out. And it seems like they may have figured out the solution, or not, maybe not the solution, but the reason for why this pain is causative, or what happens, like why these cysts specifically end up causing this pain.
Well, cysts and lesions. Not everyone has a cyst if they have endometriosis.
Right. Okay. So, yeah, exactly. So just anybody who suffers from some form of endometriosis, however it ends up representing or showing itself. And certainly you've mentioned that some people, you just mentioned it, so like some people have cysts, some people have lesions, some people don't have cysts at all, and they still have symptoms, or they may not experience any pain. So I don't want people to walk away from this thinking that this is an end-all be-all. This applies to every single person. In science, that's never the case. It's usually an average. So you're lumping together a whole bunch of people, and it's most likely going to apply to you, but you may be one of those rare individuals that's outside of the norm, and you may need specialized treatment. So, but this paper looked at mice specifically, but they also looked at humans, which made it really, really interesting, so they found a few interesting things in mice, and then they wanted to translate that to humans. So I'm not going to go over all the graphs and whatnot, but with the mice, they took out the endometrial tissue from certain mice, and then they injected it into other mice and put it in random places to allow that endometrial tissue to start growing. So these cells, which are supposed to be lining cells, are in places that they're not supposed to be, which is the classical definition, at least based off of how we understand it now, of what endometriosis is. So these mice, and then they measured kind of the behavior, if they started having erratic behavior, if they were less physically active. That was one of the outcomes that they looked at. Another outcome they looked at is the immune system. So they wanted to find out, okay, what happens if we knock out the immune system, but specifically these particular cells called macrophages. So macrophages are part of our innate immune system. Monocytes, macrophages, they're in the same family. They're essentially the same thing, and they kind of circulate throughout our entire body. And they just scavenge for problems. They just look for problems. And they're constantly communicating with our nerves. They're constantly communicating with our muscles, our brain, everything. And they're constantly just scavenging. So when we get exposed to a bacteria, for example, that bacteria enters our body, and the macrophages, the reason why we don't experience symptoms all the time is because those macrophages just get rid of it. And if they can't, then they recruit another part of the immune system. But I'm not going to go into that. What we talked about, again, off air, is that what these researchers did is that they had 4 different conditions. They had one mouse which they did nothing to. They just left it alone to just show, hey, these mice are perfectly okay. There's not going to be any problems. Then they had another mouse where they did a sham experiment where they injected it with saline or something that doesn't have those endometrial cells. And then they had another condition where they had the endometriosis cells that were injected into the mice. And then they had another condition where they had endometrial cells, but they were also injected with a drug that kills macrophages. So essentially an immunosuppressant that's specific to those macrophages and monocytes. And then what they wanted to know is what happens to this inflammation. And what they ended up finding was really, really interesting. So when they had the normal mice, the sham mice that underwent the injection without so they didn't get endometriosis, they were injected with like water or something like that. They showed no increases in inflammation expression. So our genes are expressed in particular ways. They're the blueprint of the body, of the cell, which then ends up extrapolating out to the body, to a point where our genes encode for particular pro-inflammatory molecules. So if our cells are in a highly activated state and they want inflammation, then they go to those particular genes, tell the machinery within the cell, you need to start producing these molecules, these pro-inflammatory molecules. And that's what they end up showing. They show an RNA expression. If you've taken a biology course, I know you have, but for anybody listening to this, if they haven't taken a biology course, you have these blueprints, and those get expressed into RNA, and then from RNA, so you go through transcription and then go through translation from RNA to proteins that actually are then used to communicate between cells. But here they're just looking at the gene expression. They just want to find out about gene expression. So they're looking at things like COX-2, cyclooxygenase, which is a pro-inflammatory cytokine or communication protein. Cytokine is the same thing. And that's actually elevated even with something like exercise. So when we exercise and we overdo it, our muscles will sometimes start releasing prostaglandins, which are related to this cyclooxygenase. And then they looked at TNF alpha, tumor necrosis factor. Essentially, the big point here is that they're looking at inflammatory signals, molecules. And with the normal mice, they didn't see any elevation. With the sham mice with the injection, but with no endometriosis, they didn't see any elevation. But then, interestingly, with the endometriosis mice, they found a massive spike in these inflammatory molecules. Then they applied this drug, which then dampened the macrophages, knocked out the macrophages, and the inflammation went back down. So that started to clue them in on a few different things. So then what they wanted to do is start translating that to humans. So what they took is they took macrophages or immune cells from humans, and upon taking those out, they put them on a plate, not an actual dinner plate, but an actual like cell culture plate, like a scientist might use. And then they either put the particular fluid from the cavity within our abdomen. They just took some fluid out from people who did not have endometriosis and people who do have endometriosis. And they just wanted to find out what happens to these immune cells when they're exposed to the endometrial fluid, or if they're exposed to the people that don't have this endometriosis issue. And what they found, interestingly again, is that they see these massive spikes in not inflammatory markers or molecules, but the expression of neuron-promoting molecules. So a neuron, again, I know I'm kind of like looking at you as I'm explaining this, but you already know all this stuff. Like a neuron is the way that we are able to determine pain, or really sensation in general, mechanosensation. If you look at your hand and you tap on it, that's all being processed by neurons that are innervated in your skin that then tell your brain, hey, you're getting some sort of sensation. So neurons do essentially all of the pain in terms of actual perception. And with these macrophages, these immune cells start producing more of these pro-neuronic, not moronic, but neuronic cytokines or communication proteins. So they start saying, essentially, without anthropomorphizing the body too much, they're essentially saying, hey, come over here. We need more neurons over here. So you can start seeing that this picture is starting to build here, that with endometriosis, you see higher inflammation, and this higher inflammation, which is the immune cells kind of coming to that lesion or that cyst, that leads to more of these molecules being sent out, like brain-derived neurotrophic factor and IGF-1, which is a big one that I'll be talking about in just a little bit as well. That's insulin growth factor. That's a general form of growth factor. So it essentially, if it binds to cells are then told, hey, you need to grow, you need to become bigger. So you can imagine, going back to kind of your story, right, going from 2 centimeters to 8 centimeters, a lot of those growth factors have to be there for that to actually happen, for you to have more splitting and division of those cells to create a larger and larger cyst. And here they're showing that it's specific to neurons. So neurons are being recruited to that area. So they start branching, and they end up showing that as well. So then what they wanted to do is they wanted to associate. So this is not causative. It's not like they're proving this, but they're showing an association between this IGF-1, which I mentioned, this insulin growth factor, this general growth factor, and pain perception in endometriosis patients. So not mice, but actual people. And they show a moderate association between the more IGF-1 levels that you have, the more pain perception that you feel. So that is really interesting. That's really starting to get translational in terms of kind of explaining what is happening in, what's causing all this pain. And then they actually showed it on the neurons themselves. And they tried a whole bunch of different arrays of different systems. They wanted to try different inflammatory markers, all kinds of different things. And what they found, again, that with endometriosis liquid added to these neurons, you end up finding that the endometriosis neurons, or the neurons, start to grow. And you start getting a lot of this branching. These neurons are made up of three primary parts. Dendrites, which receive signals, the cell body, the soma, which is where all the signals kind of go, and then the axon, which then sends that signal away from the cell body.
And the endometriosis liquid being the macrophage isolation from the women with endometriosis.
Right.
Okay.
So from the abdominal cavity, peritoneal fluid, they took it out. And then they just add it to a plate with the neuron in this situation, as opposed to the macrophage or the immune cell in the other situation. And then they just take images, and they just want to see over time what happens. And they find that with the endometriosis, the individuals, the liquid that came from the individuals with endometriosis, there's something in there that's causing these neurons to start branching out. So here they're making more and more links to endometriosis being affected by these growth factors that are related to macrophages and immune cells. So these immune cells are releasing all of these different factors, leading to neurons starting to what's called innervation, start to move into that cyst. So that cyst most likely wouldn't cause any sort of pain if the neurons were never able to reach that point. But for some reason, and we don't understand why, the immune cells are able to recruit these neurons to the cyst, and that's what causes this pain. And neurons are also filled with what are called nociceptors. Nociceptors are pain receptors. So they just send that signal up to the brain, and you just have this immense pain. So you can imagine, as more immune cells are going to that region, and as the cyst continues to grow and grow and grow, because they're also secreting growth factors, that leads to not only the cyst growing, but also more neurons innervating that particular region. And what's really interesting is then they tried to knock out the IGF-1, the growth factor, and what they found is the neurons no longer responded to the immune cells. So that was one of the primary drivers right there. That IGF-1 was a huge factor for why the neurons were migrating, or kind of allowing their tentacles. They really do look like they have tentacles.
Yeah.
Their tentacles to reach to that particular region. So ultimately, and then they did some measures for the mice in terms of their behavior, and their behavior did, not that I put too much stock into it because behavior with mice is very subjective, but they were more physically active. They were more energetic. They didn't groom themselves as much in terms of like just ripping away hair, because like they'll groom themselves to, not to death, but they'll bleed. I mean, they'll just continue to groom themselves, especially around that abdominal area or wherever they're feeling pain.
I can see that.
Yeah, so they just continue to go at it because they don't know what to do.
Yeah.
So once they alleviated them from these macrophages, from these immune cells, or at least when they knocked out this IGF-1, they saw this they rebound back to normal behavior. So a lot of really compelling evidence here that makes this association between the immune system for some reason infiltrating the endometrial cells that aren't supposed to be there. I mean, that's not to say that they shouldn't be in our body. They should. But they shouldn't be outside of the uterus. But once they are, the immune cells are like I mentioned, the macrophages are looking for things that are wrong. They find it, they're like, oh, this is not supposed to be here. So they start infiltrating, start releasing factors to recruit more macrophages and more neutrophils and other immune cells to that area. And then from there, you start getting more growth factors, and it's kind of a cyclical pattern. It just continues to grow and grow and grow, and that's most likely why you see, relapse. You start seeing more even if you go through like an excision, it can come back, from something like that, because the immune system is adding to the problem. So that's what could be leading to this pain. Most likely, that's one of the main mechanisms for what's causing this pain. And on top of that, potentially what they could do is start trying to target some of these like immunosuppressants and things of that nature. Obviously, the problem with that is you're more prone to infections and things of that nature. But if they can figure out some way of divorcing the immune system from attacking this endometrial tissue that's not supposed to be there, presumably then they can get rid of the pain, and at least, most likely, they'd be able to slow down the endometrial growth itself.
I want to talk about that. I had a thought about the mice. Did it distinguish between the mice that were treated? Were they all female mice, male mice? Were they female mice menstruate? Were they looking at the mice while they were menstruating, or just immediately after injecting the endometriosis they were able to say they had pain based on their behavior? Was there any of that discussed?
Yeah, so these were all female mice, and they waited for the mice to actually menstruate. Then they captured those cells that came from the menstruation and injected it into the other mice. Then they made sure that they were acting normally, and they also allowed several week period for the endometriosis to actually grow into cysts and things of that nature.
Okay.
Yeah, so it's a really telling paper, and I really love the fact that they added humans in there. There's a lot of associations that are happening, but it's certainly several lines of evidence showing that our nervous system and our immune system kind of go with our sexual reproduction, and those all three in a trifecta kind of like screw themselves over. They kind of screw each other over, leading to greater cyst growth, and of course the big one is the pain that's associated with it. So it's a huge paper. I believe it came out this year, and or relatively extremely recently, and it certainly could tell us a lot more in terms of what we can expect in the future. I
love this research because it really shows that it is a multifaceted issue. It's not just a gynecological issue. It's nervous system, it's immune system, it's so many other factors. It's not just go to your OBGYN and you're fine. Like there really needs to be a multifaceted approach, and I've always been the kind of person that's looked at the whole body and not just these different sections that we have a specialist for this and a specialist for that and a specialist for that, and they're not talking to each other about how one is affecting the other. And I think with a lot of diseases and most diseases, that's what needs to happen, and that's what this paper kind of shows a little bit. There's a lot of different factors. It's not just a bad period and
Yeah, there are all kinds of factors. Keep in mind that they've only looked at certain factors that they thought were probably most prevalent. And they did show effects. They showed differences with all the things that they tested, but that certainly doesn't mean that there aren't many, many other aspects that could be contributing to this issue. What I find most telling, and I think something you mentioned, that you can have endometriosis around your heart or your wrist or just anywhere in your body. I think, to me, that immediately throws out, like you mentioned, the retrograde hypothesis, right? But I would venture to say, if I had to absolutely guess based off of my limited knowledge on the topic.
This was a test at school.
Really?
If it was.
Oh, if it was, yes. If it were, I would venture to say that most likely it's some sort of stem cell issue, because our cells all come from stem cells, and our cells don't replicate. They don't divide unless they're some form of stem cell. If there's some sort of what's called a progenitor cell, which is kind of a further along stem cell, or a full-blown stem cell. So, and those stem cells can be anywhere in the body. In our bone marrow, they're all over, on top of our muscles, they're everywhere. They're on top of our blood vessels. So imagine if there's some sort of mutation or something, or maybe a factor. Imagine how exciting it would be to know that it's a particular factor that is specific to endometriosis that's just floating in our bloodstream. And that activates particular stem cells to start replicating into endometrial cells.
So with that, right before, this is such a huge connection for me that I've always felt like it has to mean something, because I'm someone that was never sick. I ate healthy, I exercised, never had pain or anything. I was sick with mono for a month. I found out I had mono, and then a month later, like, I guess got better. And then a month after I got better, I had a month of like health. And then this hit very suddenly. So I know the exact dates because it was my 21st birthday, and a month before that I had mono.
Right.
I really think like the mono had something to do with triggering this for me.
Yeah.
Because it just made so much sense for me. It was on the dot, like mono, healthy, exactly a month later, completely sick, like can't function in bed all the time. And I know that's not how it happens for most people. I'm not saying that that's it for everybody, but I definitely think there's a trigger, and I think that was my trigger. I really believe fully that triggered it for me. I'd never had mono before, and I was having all these symptoms, and took me forever to get diagnosed with that even. And then they're like, oh, you have mono. And then a month later I was back at the student health center, and I'm like, I have severe pelvic pain and I can't move, and
right.
I don't know what's going on.
Right.
I fully believe that had something to do with it. And
it could easily be.
Saying.
Could easily be. Yeah. Your guess is as good as mine. But I will say, I know that autoimmune issues are more common with women than they are with men, by a pretty significant margin. So it's certainly possible that you could have some sort of trigger that leads to this immune reaction. Although, and we talked again about this off air, that an autoimmune issue is a little bit different because it's the body essentially recognizing some other part of the body
that's
and
normal.
Attacking. That's normal. But in endometriosis, as we mentioned, it's not.
Yeah.
Not really. I mean, the cells themselves may be normal, but they're just not in the right place. And typically, our body is incredibly picky about where cells are. Like if our skin cells detach, they immediately kill themselves. A lot of cells in our body, they're designed that if they aren't anchored to other cells, and if they don't have a particular shape, then they kill themselves. And it's very, very cutthroat when it comes to our body because it's trying to protect us from one of the biggest diseases, cancer. But in this situation, it may be failing to have these cells kind of die off like they normally should be, or like I mentioned, some sort of stem cell issue. And if it is a factor that's just circulating in the bloodstream, then presumably we could lessen it, come up with drugs that would block it and things of that nature, and really drop and potentially cure it, which would be absolutely incredible. But we're certainly far away from that. But this paper was really interesting. I'm glad that you sent it to me, or kind of brought it to my attention. And really just the condition in general, because I didn't know anything about it until I started reading about it a few weeks ago, and reading this paper because of what you brought to my attention. So did you have any like closing remarks, anything that you wanted to mention in terms of things that you feel people absolutely should know, how to deal with it, different resources, like things, anything that comes to mind before we close this out?
I think if you, like I mentioned before, if you have any of the symptoms or have ever considered going to the emergency room, or felt like your period was always off and were just told by family members or anyone that it was normal, I think definitely go get checked out. Join Nancy's Nook. You have to answer a couple of questions before they'll let you in, just agreeing to reading the research and doing your due diligence before you start posting on there. But that's definitely a great resource. And if you connect and feel like you have anything in common enough to get checked out, definitely get checked out if you can by a doctor in your area from that Nook list. For me, once I found that doctor, so to back up a little bit, when I decided I needed to do something, I started filling out the paperwork and was actually standing right over there putting it in an envelope, my medical records and everything to send off to Atlanta because I was like, screw it. I'm just going to pay $100,000 and get this out of me. And I was scrolling through Facebook and an article popped up about a doctor in Charlotte who was now a NUC doctor.
Wow.
She had joined the group that day, and I called that day and got an appointment, and then a month later was having surgery. And it was the easiest process. Like, I had so much anxiety going into that appointment, thinking they weren't going to believe me, or they were just gonna like yell at me for not being on birth control or any of those things, and none of that happened. They did the most thorough exam I've ever had. I met with her PA first, and then we scheduled surgery. I didn't even have time to have like a consult. We just scheduled surgery. I had a pre-op appointment, and then we did it, and it turned out I had the disease. But yeah, I mean, I think that you know your body better than anybody else, and you shouldn't let anyone tell you, and definitely not just your neighborhood OBGYN shouldn't tell you that your pain is normal. And you really have to be your own advocate in that way. And I think once you're on Nancy's Nook, you're in good hands, and you can do the reading and figure it out for yourself as far as your next steps. But definitely don't give up if you think something's wrong.
Cool. Yeah, absolutely. I certainly feel more informed about it, but there's people that are really suffering from the issue, and I'm sure they're desperate for information. So I'm glad that we were able to actually sit down and get some of this information out, especially about Nancy's Nook. And I mean, just some of the subtleties that you threw in there as well. Just because you don't have like cysts, for example, that doesn't mean that you don't have endometriosis. Don't like throw it out the window and like, oh, I don't have it. Or to always believe your doctor. Like, don't always do that. Sometimes your doctor's just, if I'm completely honest, even though I'm getting my doctorate, like people can get really arrogant when it comes down to it.
They also, like working in healthcare, I see how little time a doctor has to spend with a patient.
True.
It's not just the doctor. I don't think I'm not slamming doctors at all. They're brilliant people, and I think they all get into it for the right reason. But I've worked in healthcare for a little bit now, and I see like these doctors have a 15-minute slot that's double booked with another patient to try and fix a problem, and not really, to treat a symptom, not really fix a problem. And I think I'm not going to change that. Like, no, as patients, we're not going to change it. I think being aware of it can help or hurt. I mean, it's kind of depressing, but just find a new doctor. It's not worth, I went to the same doctor multiple times, and he obviously wasn't interested, didn't have the education, didn't have the time to properly treat me. Find a doctor that has the fellowship, that has the background knowledge, so that you're not trying to educate them. I felt like I was trying to educate my doctors a lot, and that doesn't go over very well, because doctors have to be arrogant to do what they do. But yeah, just save your time.
Cool. Well, on that note, we will end it here. Hopefully it was informative to anybody listening or watching. And with that said, we'll catch you in the next time, in the next one.
Awesome.
See ya.